Hi everyone, how's everybody going? Good. We're in the home stretch, so just bear with us. So we are Team Aetna, and I guess we'll do a quick introduction. So my name is Alice Hu.
I'm David Chung.
I'm Kendall Ho. I'm Marvi Longani. I'm Samantha West.
And I'm Emma Allard.
And we have been tasked with tackling the question, how can Aetna develop benefit packages that address the needs of employers without setting expectations and commitments too high and thus overpromising? To provide a bit of context, large national insurers are seeking innovative ways to offer comprehensive and distinctive benefit packages that caters to a diverse range of employees and dependents across different socioeconomic backgrounds and geographic areas. In approaching this challenge, we've identified 3 core objectives as we look through the perspective of both the insurer and the benefit holder, where we would like to highlight transparency, distinction, and accessibility as our guiding principles in addressing the 4 proposals we derived. And a quick outline of the 4 proposals are cost-shared equitability, educational marketing, distinctive partnerships, and consumer benefits. And a good preface to put out right now is that these proposals stand as its own separate entity, or they can be treated as complements in addressing our problems.
So the 4 things that we want to cover today is how we can make our insurance plans more accessible, how we can ensure that customers are informed, how we can stand out from the market, and then also what some of the potential risks involved might be. So to start off, how can we make insurance plans more accessible? So sort of a basic outline of what insurance plans typically look like is having cost sharing equitability, where there's 4 basic tiers of plans that all cover the same coverage under the Affordable Care Act, which has 10 basic requirements, which some of those include vision and dental for children. They could be hospitalization, inpatient and outpatient care, emergency services, and among some other things. And the way that these 4 tiers are differentiated is they have different cost sharing. So the bronze plan, which is the lowest, would have a very low monthly premium and then a very high deductible whenever you use those services, which this would be a very good option for someone that's healthy and doesn't plan on using a lot of their health services. So they wouldn't have to pay those high deductibles as often. And then it continues to go up where the premium increases and the deductible gets lower for each service. So the silver plan would be the best option for less affluent members, just because there's a good balance between not having a very high monthly premium, but then also not having to pay as much for the services that you do get. And then the platinum would be best for someone that does expect to use a lot of those health services.
Second point that we want to talk about is how do we ensure that our customers are informed? A lot of different people have varying levels of knowledge on insurance, and it's important that we display transparency to these customers so that they can make an informed decision. We'd like to start by doing this with educational marketing in website changes. Now, we're focusing on website changes to the Aetna medicinal. There are 2 separate websites. There's the Aetna website and there's the Aetna website with the insurance plans. And what we want to do is we want to change the comparison system on the plan website so that information such as the images below are more available, because at the moment, using the comparison system, it only shows things like features checked off, such as eyewear coverage or dental coverage or over-the-counter coverage, but it fails to display comparisons between these numbers in different plans. Another thing that we'd like to add to the plan website is a glossary and a frequently asked questions page. At the moment, there is both on the Aetna.com website, but this website does not contain, the website containing the plans doesn't have these features, even though it would likely be a lot more useful to have these features on that website. rather than the other Aetna website. And another thing that we'd like to emphasize is preventative measures and care through more educational marketing. So here are some examples of educational marketing that could really assist consumers in helping them live healthier lifestyles, which will which is sure to benefit both the consumer and the company as well.
Market competitiveness is also a very important aspect. So, how do we stand out? In the basic insurance plan, we can create stronger partnerships with CVS Aetna adjacent healthcare to make sure it is easily accessible. Aetna is a part of CVS Health, which offers an extended array of health services beyond traditional pharmacy services. CVS Health provides some additional benefits such as wellness rooms that help with chronic conditions. Wellness rooms are a designated space where individuals participate in various health and wellness activities, workshops, and programs. CVS Minute Clinics are very similar to walk-in clinics and are very accessible, especially for consumers of a lower income. In addition to that, Minute Clinics typically have longer hours in comparison to other primary care providers. Some of the many services the CVS Minute Clinics provide include vaccines, immunizations, screenings, physicals, minor illnesses or injuries, and women's and men's services. CVS Pharmacy is another connection that makes Aetna stand out from its competitors. With CVS Pharmacy, consumers conveniently have access to prescription medication, which plays a major role in the insurance plan.
Along with the CVS Minute Clinic and the CVS Pharmacy, Aetna has also recently acquired Signify Health and Oak Street Health. They can now support those in need of in-house care through Signify and those who are under the Medicare system through Oak Street Health. Focusing on these already established partnerships can help in lowering costs and increasing the accessibility for those in need of these certain services. These partnerships now already differentiate Aetna from their competitors, but we could also consider collaborating with more local primary care doctors to lead to better health outcomes and lower costs. This not only encourages preventative care, but it also makes receiving primary care way more accessible for those who currently cannot transport to their closest doctor's offices. This also can create more options for Aetna insurance plan members to choose from. This helps make Aetna's plan way more accepted and common throughout the healthcare system. In addition, we could also partner with health clubs such as the YMCA or different gym chains such as like LA Fitness or Planet Fitness. We could provide a discount to memberships for people under the plans to encourage preventative care and encourage better health, wellness, and taking care of themselves. Having these partnerships both increase accessibility for Aetna insurance plan members and also can differentiate Aetna from other insurance companies.
Aetna and CVS's strategic partnership does make it stand out from all other companies. However, another way Aetna can stand out from the market is by providing their clients with a reward system. Now the question here arises, how does this reward system work? An example is if the client completes a certain benchmark of preventative services, for example, they have a great record of attending their annual checkups, or they have completed a set of required screenings, or basically anything that reflects that the person is healthy for a certain period of time, a certain percentage of amount can be rewarded to them. Now, this reward can be done in terms of adding a percentage of amount to their health savings account, or by increasing their insurance coverage amount, or they can even be rewarded a dividend of cash. Potential risk and cost benefit analysis was something that we thought was very important to do when we are suggesting something. Moving further, we found that we have some potential costs regarding this suggestions. A huge amount of research and development was required to accommodate these reward systems and manage pricing. And a lot of investment will also be required to implement these changes. On the other hand, there are a lot of benefits too, like loyalty of customers or clients. This states that when we are in a competitive market, when everybody is competing, having loyal clients and increasing your base would increase the revenue of the company. This increase in client base will also be occurring because the young generation will be wanting to buy more insurance as they're getting reward systems. This will eventually lead to an increase in diversity. It will also be a motivation and incentive for clients to be healthy as they are being rewarded to take care of their health. Lastly, clients can make well-informed decisions due to clarity and information provided to them.
So just a quick wrap. So in conclusion, Aetna stands as a pioneering force in the realm of healthcare, committed to bridging the gap to benefit and inequity through innovative solutions. Our proposals serve as a catalyst for transformative change, igniting a spark towards a future where every individual can access the care they need, no matter their circumstances. We seek to not overpromise our benefit plans through being clear and transparent through educating marketing strategies, while also providing readily access to distinctive partnerships and preventative care. With dedication and determination, we are not only bridging gaps, but also building bridges to a more healthy and equitable world for all. Thank you, and open up to questions.
Okay, I'll ask. CVS obviously has all these Oak Street Health, Signify. We have a lot of different companies. How do you recommend getting say, hey, you're an Aetna member, don't go to this doctor, go to Oak Street Health? Like, how would you recommend we go about doing that? And have you considered, hey, that's not a great relationship that you're then creating with other providers?
I think a big emphasis was about the distinction. So building these partnerships were able to make it more accessible for consumers, affordable in a sense. And yeah, I don't think we really looked into the consideration of how it would affect other providers. So that would be something to look in for assumptions and risks. Thank you. Hi.
I guess somewhat similarly, you mentioned making partnerships with local primary care physicians. What are those partnerships? What kind of things?
Perhaps just making the insurance plan accepted in those doctor's offices, because I know for some offices that an Aetna plan might not be accepted, because I know that only 46 states accept Aetna plans, plus Washington DC. So we could expand more and just talk to more local primary care offices, especially where there aren't a lot that are densely populated, so that people who have to travel further or have to seek other ways to get their primary care, we can make it easier for them and lower costs.
This is Mark Hogg. Are there any regulatory considerations that you thought about?
Considering what?
Regulatory considerations.
Could you maybe elaborate on what you mean by that?
Well, health insurance is governed by a number of complex statutory laws that allow some things and doesn't allow others. I just didn't know if your differentiated offerings are they legal in every state, for example, or are there other considerations that that legally you may or may not be able to offer?
Because of that regulatory reason, we thought of taking Obamacare and the primary care as like a baseline of our entire plan, so that we do not go against any regulations that have already been established. And at the same time, we also provide clients a good service. So that was the idea.
Thank you.
Talking about your risk-benefit analysis, is there any one risk that you would say stands out against all the others, and what is it?
in the risk and risk analysis, the main risk that stood out was that a lot of investment would be required in all of this. And it's not easy to make partnership with other companies and be in collaboration with everybody. So I believe that investments and along with it, accommodating everything together is one of the challenges the company could face.
So did you think about what plan you could put in place to address that?
The plan that you could put in front to adjust to that would be simply by taking it step by step, not like putting everything together, everything in front of the client, and like introducing it at every single level. For example, last year, Aetna introduced an Advantage card for their chronic disease, for a plan that requires, for the people who have a plan for chronic diseases, and they have this reward system that a certain percentage of amount is in their bank account in that MasterCard. So that's one partnership that Aetna introduced last year. Similarly, if like every periodic time, a certain partnership or a certain benefit has been introduced to the clientele, that would help like making people also intrigued with the company, keeping people busy, that they have something to work on. They also have like constant rewards also coming up. So that is one thing that it could be done.
Okay, so start out small and build it up as you get the information about what's working and what's not.
Yes.
Okay, great, thank you.
Yes.
What about the consumer? So the policyholders themselves, do you have suggestions on how to make the process easier for them to follow, since they have multiple places they can now go that Aetna accepts, right? How do you help them know what to do?
For that, we plan to introduce educational like comparison tabs. Like they can select from the plans they want. They can select from a multiple range. They can compare two plans together. That is the part where we were planning to be like clarity of information in what they're choosing, what they're planning to do, what they have to, what they're paying for, basically. So they need to know what they're paying for. And so we, through the website, through pamphlets, through newsletters, through multiple media techniques, we were planning to, suggesting that the company needs to tell their consumers what they're paying for.
What about after they've purchased the plan and they need to go see a doctor, or they need to get, stitched up or something like that, right? How do they know where to go? Since there's multiple options, you said there's like a CVS Minute Clinics, there's all these other things. Do you have suggestions on how Aetna can kind of improve the customer experience with that to make it, cost savings for Aetna, right? As far as like claims go, but also help the consumer know where to go.
You can kind of look at like the current marketing strategies that a lot of companies use. Like maybe you're looking for a Best Buy and we put in your zip code and then a bunch will pop up. So what you could have, and also like a lot of companies also implement like a little AI gadget. So like saying like, hey, I need to get stitches. Is it an urgent care type of matter or an emergency care matter?
Right. And then what's in the Aetna network? And, yeah. Cool.
Any final questions? Anyone virtually, any questions? All right, thank you so much, Team Aetna. So thank you everybody for coming out today. We ask now at this time that you fill out the scoring sheets that are in front of you. Once they're filled out, please hand them to myself, Brigati, or Jabo. Those of you virtually, Jabo should have sent out the scoring link for you. Please fill it out as soon as you can. We will tally up the scores and then announce the winner in probably a few minutes. Again, I'd like to thank all the participants. All of you did a great job.